Dr. Jonas. I'm a psychologist. So, as a psychologist, I can't prescribe medication, but I can help you with your journey and talk to you and help you with your mental disability. Now, I have some papers here from your doctor stating about what you've experienced, but I want to hear from you what your symptoms are.
Lately I've been having hallucinations, and I'm not really myself. I frequently get I think they're mood swings. I get angry really quickly and stuff like that.
Okay. Have you always been like this, or when did it start?
No, it started I think a few months ago, but the symptoms are getting worse, and now I'm worried about it.
Is there anyone in this family, or in your family, who has the same thing?
Yeah, my mother, in fact, hers isn't diagnosed, but she does have similar symptoms as I do, but mine are clearly far worse.
Okay. So you've experienced hallucinations and behavioral changes?
Yes.
So behavioral changes can be a symptom of many different disorders, but having hallucinations is a clear symptom of a disorder called schizophrenia. Have you ever heard of it?
No, I have not.
Well, okay. Schizophrenia is a disorder that affects a person's ability to think, feel, and behave clearly. We don't know what causes it, but there's a possibility that genetics can play a part in it, as it has with you. Fortunately, I can't treat you, but I know someone who can. I know a psychiatrist who does the same duty as me, but can prescribe medication to help you with your mental disability. Anyway, I want to know your progress afterwards, so maybe if you can make an appointment 4 months after you start your treatment to see how you're going so far.
Okay, sounds good.
Okay, well, it was nice to meet you.
You too. Thank you.
Hello, I'm Dr. Marwa, and I'll be your psychiatrist. My job focuses on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. What concerns or symptoms do you have?
A few symptoms that I have are, lately I want to say I have hallucinations, and also, I can't really focus right now. That's another problem I've been having. And, what was it called? Yeah, I just get angry really quickly, upset. Lately, I'm I don't even want to leave my room because people are getting on my nerves really quick over literally the simplest of things.
Are you taking any medications right now?
No, I have not been prescribed anything.
What's your family's history?
Well, so far, from what I know, my mother's the only one who has similar symptoms as I do, but that's it.
From what I've heard, you have a mental disorder, most likely schizophrenia. Treatment of this disorder will be lifelong, and it will involve a combination of medications, psychotherapy, and coordinated specialty care services. A diagnosis cannot be made, however, until you get an MRI, CT, and PET scan. After the results come in, I'll be able to diagnose you with schizophrenia, but for now, I can make you a treatment plan.
Okay, sounds good.
Coping with a mental disorder can be very difficult, however, there's ways to make it easier to live with. First, I recommend you educate yourself on mental disorders. This can motivate you to stick to your treatment plan, and it can help friends and family understand your disorder. Second, you should go to behavioral therapy. This form of therapy helps identify and change potentially self-destructive or unhealthy behaviors. Third, you should learn relaxation and stress management. You and loved ones can benefit from techniques such as stress reduction and meditation, and writing your feelings out on paper can help as well. Stick to this treatment plan for 4 months, and you should be seeing some progress. For now, I'll refer you to a radiologist so you can get some tests done. The test results will confirm if your mental disorder is schizophrenia. See you soon.
Okay, thank you. Have a good day. Hello, I'm Dr. Jamshed. I'm the radiologist. I've taken the pictures, I've examined them thoroughly, and I'm here with what I think could be a diagnosis. Well, first, we're going to be talking about the images that we took. The first one being the MRI. the CAT scan, and finally the PET scan. Okay, first off, the MRI. If you look at the image, it's clear that your brain, the ventricles are enlarged. Well, one of the reasons for this is your brain has something called cerebrospinal fluid, or CSF as I like to call it, and it is produced and stored in the ventricles. Sometimes there can be problems reabsorbing this extra fluid, and you unfortunately do have this problem. So that's why it looks like your ventricles are really enlarged. Second, the CAT scan. In the images, it's actually pretty clear that your lobes are not proportional, and the ridges of the brain, some are like darker than the other, and that is an indicator that something is wrong, and we can fix that, or at least we can slow down the progression of it. And lastly, we have the PET scan. This shows your brain energy metabolism. There are minor and major differences from a normal brain and your brain. But at the moment, we're going to focus specifically on your brain and compare it to the normal brain. And one difference is around your frontal lobe and hippocampus, there's, I want to say slight, but it is not, I'm not going to lie to you. There's color variation from one place to another, whereas they should be thoroughly, like, at least similar, not exactly the same. And that's unfortunately what you have. And I can prescribe medications for you. At the moment, I will prescribe for you an antipsychotic. This will help, slow down your troubles and symptoms until your psychiatrist and psychologist can relook at you and confirm their diagnosis. And once again, thank you so much for coming. It was great.
Thank you.
No problem. Nice to see you again.
The last visit was 4 months ago. Since then, have you been sticking with your treatment plan?
Yeah.
And have you noticed any improvements in your mental state?
Yeah, actually, I feel like I've gotten more social than I was when the symptoms were really strong.
After the test that your radiologist has performed on you, I can confirm that you have schizophrenia. As I've said, the treatment of schizophrenia will be lifelong, so you should continue your treatment plan. In addition to your previous treatment plan, I'll prescribe you some antipsychotics, specifically fluphenazine and chlorpromazine. These medications both treat schizophrenia. Follow all directions on your prescription label and be sure to read the side effects of these medications. And call the doctor if you experience any abnormal symptoms. These medications should be very effective. If you continue your treatment plan, you can have a normal life even if you have symptoms or relapses from time to time. I'm going to refer you to a therapist. She can help you manage your thoughts and your disorder. Hopefully your symptoms improve. Goodbye.
Bye.
Nice to see you.
How are you?
I'm okay now, thank you.
Have your symptoms improved?
Actually, yeah, they have slightly improved. There isn't a big difference, but there is improvement.
Okay. Well, I received a paper from your psychiatrist saying that you actually have schizophrenia. She gave you certain medication, right?
Yeah.
To treat your condition. And it's been some months. Is the medication helping?
Oh yeah, definitely. I'm more social than I used to be, and want to say more normal, I guess.
Okay. On a scale of 1 to 10, how would you rank your mental state?
I mean, now that I understand what's wrong with me, where I used to be at definitely a 0, I was in the worst possible place, but now I could say a 5.
Okay, well, progress.
Yeah.
Well, that's good. Everything seems good. You've improved greatly since the last time I saw you. You definitely look more alert and, alive. Well, seems like everything's good. I don't know what else to do except recommend you engage in outside activities, maybe do some exercise outside, join a club, but I definitely recommend you join a support group. Therefore, you can talk to other people who are experiencing the same thing you do and just talk instead of scientifically proven way to help relieve everything that you feel.
Okay. Sounds good. Thank you.
Alright. Well, it's nice to meet you, and I hope to see you again in a couple months to see your progress again.
Yep.
Alright.
Have a good day.
You too.